Okay, the other type of disease that I want to talk about is what we call restrictive respiratory disorder. From the name, these disorders or conditions or symptoms that may relate to different disorders, the major etiology here or pathology is that they restrict the movement of the lung or the lungs. So I will use one example here, pleural effusion. From the name effusion, that means a collection of fluids. As you know, here's the lungs and here's the pleural space, and in the pleural space there's a small amount of fluids between 5 to 10 milliliters. The function of this small volume of fluids is just to lubricate this area so there's no friction between the lungs and the pleural cavity. Now, for some reason, this fluid will accumulate and it will be higher volume, as you see right here. Now, this accumulation in the pleural space means that there will be less space or less room for the lung to expand, which means there will be less volume of air that will enter the lungs, and therefore less gas exchange. So there are two types of these fluids that can accumulate. It's either because of transduction, and that's had to do with more of difference in pressure and change in pressure. This is just like edema in the pleural space because of the filtration of the plasma, and so that's what you see it in patients with CHF and cirrhosis and renal failure. The other type is more of exudate, and that has to do with inflammation and infection. So infection in that area can lead. Regardless of the cause, both of them, they cause the same thing, which is restricting the expansion of the lungs, meaning less volume enter the lung, less gas exchange, and therefore could be hypoxia and hypoxemia, and eventually maybe dyspnea. The classical symptom of this that the patient shows maybe dyspnea depends on the volume of this fluid. So because again less gas exchange, that means hypoxia, and the patient may be dyspneic. Some patients are asymptomatic and some patients may show more symptoms. Now of the problem, the accumulation of pus because of infection, patient of course will show other type of symptoms that has to do with infection. Now in the pleural effusion, when you do a physical examination, again, what will happen now, because the lung are not fully expanding, the fluid, the volume of air that goes in, it's not as, it's subnormal. So what we expect to hear is diminished sound. Also, because of the accumulation of fluids right here, there is a classical symptom called a pleural effusion rub. I'll let you listen to the sound of this, and again it's because of a friction between the pleural cavity and the lungs because of this fluid in between, and you only hear this pleural friction rub in case of pleural effusion. The other thing, remember from percussion, the percussion of normal lungs will be resonance, but because now there are fluids, so it changed to dull. So let's hear what is its sound for diminished or absent. And then for the pleural rub, this is how it sounds. Now, based on the patient history and the clinical presentation, we can suspect a pleural effusion, which will be confirmed doing a chest X-ray. Again, this is a fluid in the pleural space, so it will absorb more of the X-ray. It will look like white. This could be different things, but based on the history of the patient, we know that this is a pleural effusion. Now, as far as the treatment, this amount of fluids, again, it's a pleural cavity. Usually it's not significant, maybe 50, 100, depends on its significance and depends on the type, if it's infectious or if it's just a fluid, serous fluid because of the plasma. The management is to remove that fluid. As you see, there's no problem within the lung tissue itself. This is like extrapulmonary, but this accumulation will restrict the movement of the lungs. So the best way and the best treatment is to remove it, and I'll show you a procedure how we do that. Basically, we numb the area and we'll put under the guidance of X-ray. We identify the location. We insert a needle connected to a tube under negative pressure, and we absorb it, and that's it.